next is the seated thoracic extension movement. So we talked about the mid to lower thoracic being a primary rotational spot. That upper thoracic kind of blends in with the cervical, big into extension. You see a lot of people with their shoulder problems or neck pain where they're not extending through that T1, T2, T3. This is a really nice seated mobilization. So you've already done some CPAs, now you want to move into more of a weight-bearing position. It's a really nice way to do that. So we'll make sure both her feet are on the floor. Our position is going to be like when you were a kid and you laid your head down on a desk. So arms like this and then forehead down on that arm. Okay. Now, I'm going to reach through her arms, and one big part of this is that I'm going to use my thumbs to kind of block the base of her skull. So I want to avoid any cervical extension with this. That's not a comfortable movement. With somebody with neck pain, it's going to flare them up really bad. So I'm kind of using my hands and my thumbs to block that cervical extension. I'm going to use my middle fingers together to palpate the space between the two spinous processes that I'm looking to mobilize. Right, so that's kind of my mobilization point. That's where I'm giving my pressure. And then I can use my body. I'm not going to push her straight up. I'm going to kind of pull her into me and then raise her shoulders just a little bit, right? And I can give a little bit of extra pressure. I'm at about T1, T2 right now. And just sit there just like that, okay? This is a really nice one too because I can create some left rotation, some right rotation with this. I can play with it some. Now you want to watch. Again, no cervical extension, and you want to watch for somebody that's getting a lot of extension in their lumbar spine. You don't want to irritate anything else. At the same time with this one, obviously like we talked about the other day, some of your geriatric patients, people with shoulder problems are not going to be able to get up into this position. It's going to be super uncomfortable for them. So another way you can do the same thing is to have the patient lock their fingers behind their hands, bring their elbows together. So bring it down just a little bit. Right there, kind of like cupping their head. I'm going to get real close to her again so I can kind of control her motion. I'm going to cup under her elbows, and then I'm going to try to get her to just kind of slouch into me. Just relax down. There you go. Let me have control. I'm going to use kind of a pincer grip and just cup right around the spinous process of the part that I'm trying to mobilize. And then I can kind of raise her arms. I'll raise her body up. Now again, you want to watch. She's one that's getting a lot of lumbar extension. So honestly, I may be careful doing this on somebody like her if she already had some low back pain. I may err more towards a prone CPA, UPA, look for a different way to do it. But for somebody that doesn't have a lot of low back pain, somebody that can control it well, it's a really good mobilization. Real quick, we'll go through the muscle energy technique for this also. So if she's back here, again, say we've mobilized really well into that T1, T2, and now we want to get her to control it a little bit better. I'll stretch her out, stretch, stretch, stretch. Now, at the end, I'm going to tell her to push her elbows down into my arms as if she's trying to do a crunch, right? So she pushes down, she's creating kind of lumbar and thoracic flexion, engaging those abdominals, and relax. And I give her a little bit more of a stretch. And one more time, push. You hold it about 8 to 10 seconds a lot of times and relax. You stretch it again. All right. Again, this can help loosen up the joint. You're getting some neural input into the joint, so you're just trying to facilitate them controlling it a little bit better.